Pursed lip breathing is a very simple technique that could be used to slow down your breathing and get more air into your lungs. With regular practice, it can help strengthen your lungs and make them work much more efficiently. So you can use pursed lip breathing during any activity that causes shortness of breath, including exercise, standing up from a seat, or lifting something that might be heavy. It might take you some time before the technique feels natural, but with regular practice, it can become comfortable. So here's how you do it. First, you want to make sure that you're nice and relaxed. It might help you to close your eyes when you're trying this for the first couple of times. You're going to breathe in through your nose for about 2 seconds. Make sure your lips are closed. And you don't necessarily have to take a very deep breath. It could be just a normal breath. From there, you're going to purse your lips as if you're about to blow out a candle or whistle. And you're going to breathe out slowly throughout your mouth from 4 to 6 seconds. Just try to make sure that you're breathing out for about twice the amount of time that you breathed in. So it should look something like this. And you can repeat it for as long as you need to. So with regular practice, this breathing technique will release any trapped air in your lungs, allow you to keep your airways open for a longer period of time so that you take less breaths, but these breaths are much more effective.
Hi everyone, so today I'm going to be talking to you a little bit about a technique of breathing, a type of breathing called diaphragmatic breathing. So first I'll be explaining the purpose behind this. So the purpose of diaphragmatic breathing is to encourage full oxygen exchange. So this is called, otherwise known as the beneficial trade of incoming oxygen into your body and outgoing carbon dioxide out from your body. So this type of breathing can actually slow down your heartbeat and it can lower and stabilize blood pressure. So it has a multitude of benefits. And next I'll be explaining when you should be using diaphragmatic breathing. So diaphragmatic breathing should be used, really can be used by anyone, but especially for people with COPD, which is a lung condition. And it helps people with COPD strengthen the diaphragm, which can in turn help them use less effort and energy to breathe. So now I'll be explaining a demonstration, so how to actually do diaphragmatic breathing. So just to preface, you can do this either lying down or sitting up. I'm going to be demonstrating how to do it sitting up. You can do it lying down if that's what you prefer, but when you're sitting up, I think it requires more awareness, I think, of your body, which can in turn help more with this technique. So you want to start up as you're sitting up. You're going to place one hand, I'm going to just place my right hand on my chest and my left hand on my stomach. Okay, so once you have both hands here, you're going to take a deep breath through your nose. And then once you have inhaled enough, you're going to exhale through your mouth. And when you do this, just to make it more clear, your chest should not be moving like at all. It should only be your stomach, your abdomen moving. So if you feel your chest moving, that means that you're engaging your chest muscles to help you breathe, when really it should be all about your diaphragm, which is like located not up here, but down here. So you're going to take a deep breath in through your nose, feel your abdomen rise. So do you notice how in those 3 breaths that I took, my chest was not moving at all, but my abdomen, the hand on my abdomen was moving. So that's how you want to go about doing diaphragmatic breathing. The air that should be felt should be down through your abdomen. So you should feel air coming in, almost filling your stomach, and then air being pushed out from your stomach and out through your mouth. So some common mistakes, like I said before, includes not breathing in through your nose and then not breathing out through your mouth. So you want to make sure that you're breathing in through your nose and out through your mouth, not the other way around. Other common mistakes, as I said earlier, is using your chest to breathe. That kind of defeats the purpose of diaphragmatic breathing, because when you're using your chest to breathe, that automatically becomes like a very shallow breath, and you're not really engaging a lot of the muscles down here to help you breathe. So I'll just demonstrate this one more time. I'll do 3 breaths of diaphragmatic breathing just so we can close off and you can be reminded of how this works. So one hand on here, one hand down here. And that's it. So you can really do this technique of breathing at any time, right? Like you don't necessarily have to be lying down to do diaphragmatic breathing. Like if you're at work and you want to take a little bit of a break, you can just, really quickly 3 deep breaths. Like generally, if you take more breaths, it will have more of a benefit. But I hope that this helps and that you're encouraged to practice diaphragmatic breathing throughout your daily life and that this helps you.
Hi everyone, so the next technique I'll be going over is called controlled coughing, or also known as huff coughing. And coughing in general is just how your body tries to get rid of the mucus, but the kind of coughing that you cannot control can actually make things worse. And it can actually cause your airways to close, which traps the mucus in your lungs, which we don't want. Now, this technique, controlled coughing, or huff coughing, comes deep from within the lungs, and it actually helps loosen the mucus and helps move it up through the airways. And it's best for you to do this technique after using your inhaler or after medications. And now I'll be just going over some steps as to how to actually execute this. So first off, you just want to make sure that you're just sitting on the edge of your seat. So instead of laying back, sit on the edge. Keep both feet squared to the floor. Get comfortable. You can lean forward a little bit and just relax. So lean forward. So I'm going to exaggerate now. I'm going to lean forward. You want to breathe slowly in through the nose. And then once you're doing that, put your arms and just tuck it underneath your belly. You want to make sure that it's not too high, but it's right under your rib cage where your diaphragm is. That's where you want to get to the base of the lung. So just make sure you find your rib cage, place it there. So usually the belly is a good area. So pretend you're giving yourself a big, nice hug. So while you're doing this, breathe in slowly. And then when you're exhaling, I also want you to push your arms against your belly. So while you're exhaling, I want you to also cough 2 to 3 times with the mouth slightly open. So it'll sound like this. It'll be inhale, exhale. And you want to just lean over. So now, you want to make sure that the coughs are short and sharp, and you want to make sure that you push on your belly at the same time as you cough. So I'll exaggerate it. So inhale, then exhale, while leaning forward. So the first couple coughs will actually help bring the mucus through the lung airways, and then the third and fourth coughs will usually bring the mucus up and outwards. So once again, if we were to repeat a couple times, so inhale again, so slowly and through the nose. You don't want it through the mouth because that's where you want the mucus to get out. So in through the nose, and then cough. So it's really important to make sure that you're not taking quick or deep breaths through the mouth, as that's the pathway by which mucus can exit. And just rest and repeat if you need to.
Next exercise is going to be something known as postural draining. This helps with draining the mucus from your lungs. It's important to do this 30 minutes after you've taken your inhaler on an empty stomach, and if you need to cough, go ahead and sit up. Follow these steps for postural draining. Lie down on a bed or the floor. Use pillows to help you with different positions. Lie on your back. Make sure that your chest is lower than your hips. Put 2 pillows under your hips. Use a small pillow under your head. Keep your arms at your side. Then follow these instructions for breathing. With one hand on your belly and the other on your chest, breathe in. Push your belly out as far as possible. You should be able to feel the hand on your belly move out, while the hand on your chest should not move. When you breathe out, you should be able to feel the hand on your belly move. This is called belly breathing or diaphragmatic breathing. You will use this in the other drainage position too. Now, to drain the sides of your lungs, do this step as you lie on one side, then turn over and do it on the other. Place 2 or 3 pillows under your hips. Use a small pillow under your head. Make sure your chest is lower than your hips. Use belly breathing. After 5 or 10 minutes, switch sides. Now, to drain the back of your lungs, lie on your stomach. Place 2 or 3 pillows under your hips. Use a small pillow under your head. Place your arms by your head. Use belly breathing.
Hi, so I'll be going over a technique called chest percussion. The goal of this exercise is to loosen the mucus off the side of your lungs to clear your chest. This is usually performed before controlled coughing so you can cough up the thick mucus buildup more easily. This exercise is especially useful if you perform them in the postural drainage positions, so if you're tapping on your chest, you want to lie on your back and so forth. And it's best to perform this exercise in the morning or right before you go to bed to minimize buildup of mucus overnight. There are several ways to perform chest percussion, and there are even electronic devices now which you can wear to vibrate your chest. Today we will just be going over a simple manual version you can perform with your hands. To start, you want to slightly cup your hands like so and start assertively tapping your chest. But it should not be painful. You want to aim for a rhythmic, strong tap. This tapping can be done over your ribs, on the side of your chest, or on your back. Take care not to tap your breastbone, which is in the middle right here, or your spine. If any of these places are hard for you to reach, or you want to try to do them in the postural drainage positions, it might be best to get someone else to help you with them. And that's it.